1.
After giving 2 rescue breaths, the next step in the ABCDs is C, circulation. Check the carotid, or neck pulse, for no less than 5 and no more than 10 seconds. If you're not sure about the presence of a pulse after checking for 10 seconds, begin compressions. To check the carotid pulse, use one hand to maintain an open airway. With the other hand, locate the trachea near the Adam's apple. Slide 2 or 3 fingers into the groove between the trachea and the muscles at the side of the neck. Feel for 5 to 10 seconds. If there is no pulse, or if you're not sure you feel a pulse, begin chest compressions. Use the carotid artery to check for the pulse of an adult or child. To check for an infant's pulse, use the brachial artery. While checking circulation on the infant, maintain an open airway. Use 2 or 3 fingers to feel inside the upper arm between the shoulder and the elbow. Take 5 to 10 seconds to check for the infant's pulse. Feel for a regular pulsation under your fingers. Avoid pressing too hard because it can occlude blood flow through the artery. For adult victims, begin compressions if there is no pulse. For children or infants, start compressions if the pulse rate is less than 60 beats per minute and there are signs of poor perfusion such as cyanosis or mottled skin. If you're not sure if you feel a pulse, begin chest compressions. Remember that effective chest compressions are the most important part of CPR and are directly linked to increased survival rates. Let's look at how to perform chest compressions on an adult victim. If there is no pulse, begin chest compressions. Remove any clothing that may interfere. Place both hands at the center of the chest between the nipples with one hand on top of the other. Provide 30 compressions.
1,
Press
2,
firm and
3,
fast with
4,
the heels of your
5,
hands.
6,
Keep your
7,
fingers lifted
8,
off the chest
9,
wall.
10,
Count
11,
each compression
12,
out loud.
13,
Maintain a
14,
rate of
15,
100 compressions
16,
per minute.
17, 18,
The depth of
19,
compressions for an
20,
adult
21,
is 1.5
22,
to 2
23,
inches.
24, 25, 26, 27, 28, 29,
After 30 compressions, give 2 rescue breaths and immediately resume compressions.
One, 2, 3, 4.
Keep
5,
your shoulders over the
6,
victim
7,
and your arms
8,
straight.
9,
Use your
10,
body weight,
11,
not your arm
12,
strength.
13,
Press
14,
straight down.
15,
Do not rock
16,
side to side.
17, 18,
Allow the chest to
19,
fully
20,
recoil
21,
between each
22,
compression.
23, 24, 25, 26, 27, 28, 29, 30.
Provide cycles of 30 compressions to 2 breaths. At the correct rate, rescuers should provide 5 cycles of CPR in about 2 minutes. Minimize interruptions to compressions to keep the blood flowing and improve the chance of survival. Remember, A stands for airway. Open the airway and check for breathing. If there is not adequate breathing, give 2 rescue breaths and check circulation. If there is no definite pulse, begin chest compressions. Let's discuss the next step in the ABCDs.